that before. But it still involves people. It isn't you have to be alone and stay home. So, you have to be part of a team. Business is such a team sport. As I said earlier, when you can fail together and win together. But if you collaborate, you can continue the innovation. There's very few people that I know, actually, I probably know none, who have actually come up with something all by themselves and was perfect and got to market and became a billionaire. I mean, that's not Elon Musk. It isn't Mark Zuckerberg. They've all had teams. We all know about their big successes. But, Zuckerberg, he has teams. He keeps evolving his teams. I do the same thing. I have a core team of people, but we communicate on a daily basis. We fail regularly. Hopefully we don't make the same mistake twice, but we collaborate together, and even in our successes, we win together. So it's not a corny structure or corny thing to say. Life is so much more fulfilling when you're working together.
Yeah.
I travel a ton. I'm so fortunate to be in the field that I'm in. I have friends all over the world, in Israel, Turkey, Argentina, Brazil, France. I try to bring my family with me as much as I can. If I'm there for a conference, I'm going to the French Open or to a World Cup game with friends to share the memories. And you want to do things with the people that you have fun with and love, and also bring people in with you to say, this is how we win. We can all win. So, it's, collaboration and innovation could mean so many different things, but if you can do it together and keep inspiring people, then it's a lot more fun, and then the world just gets better.
I think right now is a great time to collaborate and innovate, because for the most part, we're on lockdown of one form or the other. We're doing a Zoom call right now, but we can allow ourselves to be very creative when we're in our own space and not allow the distraction of a virus and some of the turmoil that's going on in the world to really focus on what we're passionate about and reinvent ourselves. And through that, maybe be innovative with something that the world needs. It's fascinating how many different types of face masks there are out there now in the last 60 days.
I don't know if they all work, but at least they're wearing.
Well, at least people are trying to figure something out. It's amazing to me when you start talking about innovation and the things that have been created out there. When I was a kid, we were so fascinated that we had an uncle that designed and created those little speed bumps, reflective speed bumps on the highway.
Oh, yeah.
Right? I mean, somebody had to do it. That happened to be my uncle. He did very well off of it. You drive down the freeway and you see all these little bumps.
Got a patent.
Yeah, he had a patent on it. And I just, when you think about stories like that, and certainly you coming back from Michael's with this yarn and this foam ball, trying to create, there's just possibilities around us everywhere to create and innovate.
100%. The person that invented the yellow sticky pad at 3M.
Yeah.
That was an unintended consequence that I think that was invented 35 years ago. The patents have expired. Okay.
Yeah.
But imagine that wasn't what he was trying to do. He was trying to make something really stick and form a better adhesive, and it peeled away. So you've got to be able to recognize, even when you fail, hey, this could be something we could be using here. And that's what I see a lot in medtech, at least in our field, is you're really going after something bigger than what you're trying to do. But it's those small wins, the base hits, that really lead to the innovative process. And yeah, you can fail big and okay, that just didn't work. It wasn't strong enough. But sometimes they're just minor failures that you can look at that and have a group meeting. There may be somebody in the room that says, I think we can use that here. So when you can collaborate and work as a team, it's just limitless.
Yeah. What advice would you give to our listeners that want to go into your field and pursue a career?
You have to network and build a team of people, but be a good listener also. Try to identify problems that are solvable. There's great things we would like to see in the field of stroke and the ischemic and hemorrhagic stroke. we're just not there yet because some of the materials just aren't, they're not available, or, virtual reality, that's not just the game anymore. Okay. Um, artificial intelligence has kind of spawned what's called VR and AR. So there's augmented reality, which what the physicians in our field are doing is they're taking the data from imaging, from an MR scan or a CT scan or a DSA, and they're able to recreate the anatomy inside the body, that rather than watching a screen that is generated by radiation, they can watch a computer generated screen of what's happening inside the body, and then move a catheter inside the body by watching a screen that is tied into a sensor that's on the catheter. I mean, this was Star Trek 50 years ago. They're doing that today. Wow. So, don't stop dreaming of those things, but, go for the incremental improvements. But you can only do that if you can collaborate with people, be a good listener, stay within your lane, build a team of complementary people, and then you can get some base hits and doubles and wins, and then once in a while you get a grand slam. But I would take 4 base hits over 1 grand slam, because it just keeps the team working together. It keeps you fresh. You're succeeding. So those are many things, but I live those with all the companies that I work with now. You can't go to a physician with a solution. I mean, they have to have a problem first. So you have to look for problems and listen for problems. I attend conferences every year. Well, not this year; they're all virtual. But I tune in to listen. But I really enjoy listening to the physicians on the podium giving a presentation on whether it's a clinical trial, a new technology, a problem that they have, because that could be the next device. There's always issues, and hopefully they're not big ones, but I like, okay, how can we make that easier to use, or make it into a faster procedure, or use less radiation? The physician would love to hear all those things. If they can just do 1 or 2 things different versus changing the whole procedure, then it's going to be safer and less scary and have more success. So, get out there, network, attend conferences, listen, be problem solvers, build a team. That's how it works.
I've always been fascinated by my cousin's husband. His name is Don May, and Don's in your field. And what was fascinating to me is that when we were young, he graduated college, top of the class. He's that smart guy. And he landed a job at Coca-Cola, and he was one of their top salespeople within a short period of time. And you just thought, wow, the guy's great at career building and doing what he's doing. And he switched careers and went into the medical field and started selling, heart devices. I thought, wow, what a change. And I remember him bringing home the books to study to go into that field. And, of course, he already had the IQ to study. But now he's one of the top guys in the industry in his world. And, I hear stories of being in the operating room and helping the doctors work with the equipment that they've purchased from his company. And I just thought, wow, here this guy, I'm thinking, here this guy came from Coca-Cola, and now he's in the operating room. But the point I think I'm trying to make is that if you have the intelligence and the capacity to learn and willingness to learn, you could be in any field, including the field that you're talking about, if given the right set of circumstances.
It takes time.
Yeah.
So just imagine, I went to college for 4 years, and I do what I do. How many years do you think doctors go to school? Mm-hmm. Okay. They go to college, and then they do 4 years of medical school. Then they do 2 years of residency. Then they do a fellowship. So any physician is not out there with a job making money until they're probably in their early 30s. So if they're going to take the time to study to be really good at their craft, then as an engineer, as a salesperson who wants to work in this med tech field, you have to study alongside them. You have to go to the conferences and learn and read the journal articles and practice. And the physicians, they call it a practice. I kind of joke with them. They're always practicing.
Yeah.
But they're not really practicing. They're actually doing, okay? Well, we have to do the same thing. You have to keep practicing. Stay sharp. If you want to jump to the next curve or make a pivot, you don't just do it because you had an intuition. You have to be exposed to that and understand. I mean, like I said, artificial intelligence, I think I heard that 20 years ago. Well, now it's become augmented reality. It's reality now. They're doing it.
Yeah.
But that took time and practice and failure and success. So, I mean, your brother-in-law there, he studied,
Yeah.
and he wanted to learn, or he wanted to be challenged, and that's the key to it. If you're content and you want to be complacent, that's okay too. I mean, there's I forget where I learned this. It actually may have been from Guy Kawasaki. There's all this comfort zone we have. We love being in the comfort zone. Just hanging out on the couch, lazy, watching ESPN. Okay, that's your comfort zone all day long. But when you're in business, if you don't even get out of the comfort zone, you're kind of toast. Okay, outside that is the learning zone. You're studying, you're doing all these things. It's a kind of sharpen the knife. Outside the learning zone is what I call the out of control zone. Okay, that's where big stuff happens, big stuff fails. I like to straddle between the out of control zone and the comfort zone, the learning zone. So if I'm constantly living that fine line of learning and out of control, my comfort zone gets so big, and it's more fun out there. You're meeting different people, you're being exposed to different ideas. Some may be crazy, but you can apply those maybe in a year from now, or maybe you can apply them now. So I love to be in that out of control zone, learning zone on a regular basis. And, then you can kind of debrief and take a vacation and get back to the comfort zone. Okay.
Yeah.
But I love that. And maybe that's what he's also seeking or he strives for.
Yeah. I think there's a lot of value, as you said, in that out of control zone and connecting with people. As individuals, we all bring so much value to the equation if given the opportunity. And oftentimes that opportunity is just listening, right? Listening to what they're saying and doing, and you can be a part of that. You talked briefly before the show about a book maybe coming out later this year. Is that something you can talk about?
Yes. Forbes is publishing a book that I wrote called Innovation in Translation, and it's coming out this December. It's a long project that I've worked on with my ghostwriter, Bev West, and it's really how to bring a medical device idea to market. Starting off with that kind of initial idea, the problem, filing a patent, putting in your own money, building the prototypes, writing a pitch deck, raising real money, then developing the product, getting it approved through the FDA, through the European Union, like how you commercialize it, and then eventually how you would exit, and then kind of rebooting and starting it over again. And in each of the chapters has a lot of stories of where I failed, where I've been successful, how I built teams, how I built boards, how I raised money, all the different ways. Because over 30 years in the medtech business, I've been able to learn and ebb and flow and realize how fun it is to be an entrepreneur and work with physicians and really develop the technology that eventually had to be developed 30 years ago would have helped my grandfather.
Yeah.
But it's been a fun process. It wasn't originally an idea that I had to write a book. I was inspired through a friend, Oren Klaff, who wrote a book called Pitch Anything. And his second book is called Flip the Script. He's an investment banker that I met, and he helped me close my last acquisition of Blockade to Vault. And we became friends. We have kids roughly the same age. And he's like, man, you should write a book to teach people how to do this. I'm like, who wants to listen to me? And then I took it a little bit more serious. I was like, oh, this is really, I'm showing people a template. And this could be for physicians, for engineers, or it could be applied outside of medtech.
Sure.
So yeah, it's something I'm looking forward to now, and it should be published, I'd say around Christmas time.
Great. Well, what an accomplishment. It's amazing listening to you and your story and what you do. And in the back of my mind, I'm thinking what he does saves lives. It really does. It saves or changes lives. What I do, people either are full and happy or they've had a few drinks and they're enjoying their night, but you're saving lives.
Well, I'm helping physicians save lives, so it's part of the physicians team.
Yeah, that's awesome. Hand it straight back to them. Dave, where can people look you up? Or I know you do a little public speaking here and there, and work for a number of companies, motivating and getting them charged up. Where can people find you?
Yeah, think the easiest way is I am on LinkedIn, Dave Ferrera, but I just formed a new company recently. It's called Quantum Fund